e-learning platform based out of the United Kingdom, and we've enjoyed a very long and fruitful working relationship with Medvarsity, and I'm delighted this evening to have been asked to present to you all. Feel free to type any messages into the chat box. I won't be keeping an eye on those, but Dr. Ritika will do that. And Dr. Ritika, just feel free to interrupt me at any time if there are questions that are relevant to the particular topic that we're talking about. If Absolutely. Not, I'm happy to answer any questions at the end. That's no problem.
Absolutely.
So the agenda that we've got this evening is very much around explaining what e-integrity is and our vision, mission and values, what we offer, our links with the medical royal colleges that are so highly regarded, both here in the United Kingdom and of course internationally, a brief overview of the extensive range of programs that we have, something about the size and scope of e-integrity, just to give you an idea of the scale of the operation that we run, and then of course some of the benefits of being a customer, a partner with e-integrity, and a little bit about what our partners say. In order to build up the picture of what e-integrity is, just forgive me, I'm sure lots of you are familiar with this, but it's important to understand the structure of healthcare in the United Kingdom. So of course, many of you, most of you, I'm sure, will be aware of the National Health Service, the NHS, which is the public health system for healthcare in the United Kingdom. So what is the NHS? In 2020 to 2021, it received funding of around 129 billion GBP, which is about 12% of our gross domestic profit. And services include primary care, ambulance services, mental health, community, and of course, acute hospital services. The NHS is the 5th largest employer in the world, with over 1.3 million staff members. Each day, we have over 835,000 people attending primary health care appointments. And primary health, just as a note, accounts for 90% of all contact with the NHS, so patient contact with the NHS, but only 10% of the budget. We have 250,000 patients attending outpatient appointments every day. There are over 30,000 calls to 999, which is our emergency service that triages the ambulance services to attend to patients needing pre-hospital care. And we have about 50,000 patients attending A&E departments, so ED, emergency departments, each day, and about 20% of those are admitted to hospital every day. So that's what the NHS is. A part of the NHS is currently known as Health Education England. Health Education England is part, as I say, of the National Health Service, and its primary function is to plan, to recruit, to educate, and to train the healthcare workforce in the United Kingdom. And within Health Education England, there is a part of the organisation that is known as Technology Enhanced Learning. It's a specialist team that supports digital education, and by that, it could be as something as straightforward and as direct as e-learning material, but increasingly the team is working on blended learning solutions, extended reality, virtual reality programs, whereby students have access to incredibly high quality training, but they are not necessarily in a university, they could be studying at home, but with the use of VR technology, for instance, it is as if they are in a lecture theatre in a university. So really starting to pioneer some work here is what technology, the TEL team, Health Education England TEL, are up to. So effectively, Health Education England is the strategic workforce body of the NHS to ensure that the future health workforce is in the right numbers, in the right place, with the right skill mix to deliver excellent care. As I've just alluded to there, to use or develop and use new technologies to support the aim of number one, and of course to assure, and this is very important in the context of e-integrity, to assure that the quality of the learning environment and the support that is in place supports patient well-being and patient safety as being two of the primary roles. There's also a piece there about consistency of training as well. So if you were in the north of the UK, you would receive just as good a training as if you're in the south of the UK, so that there's a commonality of platform and therefore a repeatability of the training that is delivered. So we've got key expertise in a varying sort of areas, but the one I wanted to highlight is down the bottom here. So is about the commissioning and the quality assurance of the educational and training material available in the UK. So again, drilling down a little bit further, part of what HEE do, Health Education England do, and this is where we come in, is the e-learning for healthcare platform. So e-learning for healthcare has a large number, over 500 in fact, programs to educate and train the health and care workforce in the UK. The content is all on knowledge sessions, scenarios, assessments, raising awareness, and is supported by simulation and reference materials, as well as in-course assessments sort of throughout the content of the program. It's incredibly high quality training material. It's peer reviewed by professionals from the Royal Colleges and other professional bodies in the UK. It is no content is older than 3 years old. Everything is reviewed within a 3-year window. But of course, if legislation changes or if best practice changes within that window, of course, content is updated real time. And it's within the boundaries, the geographical boundaries of the United Kingdom. It's free at the point of consumption for all NHS, National Health Service workers. So as I mentioned, there's over 500 programs. We have 2.4 million registered users. There are typically every month 4.8 million sessions launched, and over 28 million session launches per year. So sorry, 4.8 million was the biggest month that we've ever had in terms of session launches. Around 2007, it was noted that, or there were lots of requests that were coming in for international access to some of these high quality learning programs. And a company called e-integrity, which we've already mentioned is a community interest company, was formed. So e-integrity was formed in 2007 with the specific view of working with partners such as Medvarsity to make this high quality content from Health Education England and supported by the UK's medical Royal Colleges available to an international health and care workforce. We're governed very strictly by an executive board made up of members of the medical Royal Colleges and of HEE very senior executives. And our vision is to be recognised as the trusted provider of high quality, accessible digital e-learning for the global health and care workforce, with the goal specifically of improving patient care globally. Our mission within that is we're a global licensor of health and care e-learning programs developed by the NHS and the UK's healthcare professionals and professional bodies for the benefit of the NHS, but we then take that content and enhancing the training available to the health and care workforce across the world, thereby improving the care available and open to patients. And our values are very much about being a trusted partner, about being inclusive, about being very, very accessible to the health and social care workforce internationally, and to having a collaborative approach with our specific learners and also through our partners such as MedVarsity. So what do we offer? We offer over 100 high quality learning programs. We don't offer all 500 programs that are on the e-learning for healthcare platform that would be available if you were an NHS worker in the United Kingdom. And that's quite simply because some of those programs just aren't applicable outside the geographic boundaries of the United Kingdom. They're very specific to maybe specific programs or specific issues in the UK. So we just take the programs that are applicable internationally. As I said, they're peer reviewed by leading clinical experts in partnership with the UK's medical royal colleges, regularly updated. The IP is protected very carefully and it's guarded very safely and very well, in fact. And programs are packed with interactive features and animations and videos, case studies, real life case studies, to enable the learner to really embed and appreciate the quality of the learning, and also to stimulate reflective thinking. So it's not just about almost consuming the learning and getting through the program. It also that there's sections in most of the programs that stimulate just a bit of reflective thinking for the learner. The content is highly standardized to deliver a consistent training approach, and that's particularly useful in geographies where health and social care teams are dispersed across multiple locations, but you want to have a commonality of learning approach. And as I've already said, they're used by thousands of learners, both in the United Kingdom and worldwide. So I'm sure you can appreciate the key benefits there. I'm not going to go through those because we've talked about them. But two things that I'm just going to highlight is obviously this content is available 24/7. And one thing we've noticed pre and post pandemic is there is a change globally in the way that people learn. So pre-pandemic, what we saw was lots of people would log on to a program and maybe sit for 2 hours or so working through various modules in quite a 2-hour block. That's quite a lot of time to sit doing e-learning. Post-pandemic, well, during the pandemic and then post-pandemic, we've seen that that learning style changes. So the average time that people log on to consume some e-learning is 30 minutes. And all of our sessions are designed to be broken down into 30-minute sessions so that learners can dip in and dip out and just consume in a fashion that suits their lifestyle. Because obviously the content is available 24/7. So if you've got half an hour to consume a session, very easy to log on, consume that session, and then go back to looking after your children or your family, or indeed other commitments in the workplace. So the medical royal colleges and professional bodies that we partner with are started off as 16. We've added a couple this year. So big partners would be the Royal College of Anaesthetists, the Royal College of Radiologists, the Royal College of Physicians, the Royal College of General Practitioners. Lots of our programs come from those partners. We also have programs from the Faculty of Sexual and Reproductive Health, the Faculty of Dental Surgery, which is within the Royal College of Surgeons of England, the Royal College of Obstetricians and Gynecologists, the British Association for Dermatology, and colleges that we're just adding are the Royal College of Midwives and the Royal College of Nurses, as well as the Royal College of Emergency Medicine practitioners as well. So you can see a really good cross-section of Royal College involvement that crosses the boundaries and crosses the whole gambit, if you like, of healthcare delivery. One of the questions that comes up very frequently is, are the programs CPD or CME accredited, if you like? Many of the programs are indeed CPD accredited, but within the UK, because it's very specific to a Royal College, for instance, or a professional body registering, if you like, the course as being CPD applicable. However, what we know from our experience is, if you approach a relevant college in your own geography with the provenance of the courses that we've got, because the Royal Colleges in the UK are so highly regarded, generally speaking, CPD or CME points can be awarded, and it tends to be in line with the UK principle, which is, generally speaking, 1 hour of e-learning equates to 1 CPD credit. But again, you do have to check that locally from a specific point of view. In terms of the programs that we cover, or the areas that we cover, obviously we've got a lot of material on anesthesia, some really good programs on child health, all the way from newborns right the way up to adolescent health. A good number of programs on leadership and management, so maybe some of those non-clinical skills for healthcare management teams. A number of courses on medical conditions such as asthma or chronic heart disease or diabetes, for instance, within medical conditions. Some really good programs on mental health, which is clearly becoming more and more of an issue, not just in the UK, but globally as well. Lots of content, a very good series of programs on midwifery and caring for newborn children. An area that we're developing quite quickly around nursing. So I mentioned earlier on that we've got a new collaboration with the Royal College of Nursing. So there's lots of courses coming on into that area. We've got a really extensive program around radiology, things like MRI safety, as well as interpreting clinical images. We also have a really good program for radiologists studying to become fellows of the Royal College of Radiologists. It's almost like the revision schedule for sitting that exam. We can't guarantee that the radiologist in question would pass the exam, but the material is there, and we have a similar program, in fact, for people wishing to sit the exam for becoming a fellow at the Royal College of Anaesthetists as well. Some soft skills and management, that would be sort of making every contact count with a customer, and care and compassion with patients, for instance, delivering bad news with patients. And then we have a whole raft of courses around clinical specialties. So that might be dentistry, it might be around dermatology, it might be around endoscopy, for instance. So some real, although endoscopy technically isn't a clinical specialty, it's obviously a technique that's used, but you know, a dozen programs in that area. All of the programs are structured in the same way. So I mentioned earlier on that we have this principle of all learning sessions being about 30 minutes long. Sessions are then aggregated into modules on a particular subject, and then modules are aggregated into programs. And again, you know, there's a vast array of sizes of programs. Some of our programs are very modest. They might only contain 10 sessions. Some of our programs contain 200 or even 300 sessions if they cover you know, particularly complex areas. At the end of each program, you receive a certificate of completion that has the badging of the relevant professional body. So you can see here, this one has the Royal College of Anaesthetists as a badge on. It puts your name in, and obviously when you completed the session. On the second page of the certificate, it also itemizes the sessions, how long the learner was in each of those sessions, and if there are any assessments within those sessions, it will give your score that's relevant there. Depending on how you access the course, there are some nuances, some small changes around the certificate, but in general, this is the style of certificate that you get. So in terms of our activity, in 2022, we had learners in 147 countries up here. We saw a big increase in the number of session launches. So this is just for e-integrity. So this is the international arm of what's available in the United Kingdom. So we saw over 500,000 session launches. We had 145,000 learners enrolled in the system, and over 275,000 sessions completed here, and getting on again for 250,000 learning hours that were delivered through this platform. Feedback is very, very strong. Occasionally, I'd be lying if I said we didn't get any negative feedback. Occasionally we do, but that is generally about a clarification on a particular item within a course, or perhaps querying that, you know, is this it's more of a language thing, because all the content is in English, and just kind of interpreting what the language means. All the feedback that we receive goes back into the program developers, and where appropriate, that feedback is acted on, and changes are made to the program to make them more inclusive. So you can see here the split of learners by region. We still do have a number of learners in the UK, but more so in Ireland. For those of you that know the geography well, Ireland is split into two. Part of it is part of the UK, but a large chunk of it is independent, but and is part of Europe. But the learning, that healthcare learning is very relevant there as well. So we do sell content to the non-UK part of Ireland. And there are some private providers in the UK as well that we sell content to, because they are not provided with free access, because they're not part of the NHS. India, massive market for us. Europe and Middle East, also very, very big for us. But you can see down here, North America and South America are quite modest markets for us. South America is because we don't translate any of the material, so it's in English, and obviously predominantly in South America we find Spanish and Portuguese as being the principal languages. In terms of the most popular content, again, I said earlier on, anesthesiology accounts for almost 40% of the content that is consumed. Radiology, between radiology and clinical imaging here, is about 16%. If you added in IRMA, which is the ionizing radiation regulations, that takes it up to over 20%. So you could say that radiology is kind of 20% behind that. Dentistry is very, very popular, and then acute medicine down here, and electronic fetal monitoring, etc., are some big programs. But you can see here that 13% of our content consumed are what I've just classified as other. So we have a large number of kind of smaller programs that are less than 1% of the overall revenue generated, but there's a lot of them. As I said earlier on, there are over 100 courses. We are adding to those courses on a monthly basis, so that e-learning for healthcare are increasing their courses, and many of those programs are applicable to an international audience. So we are now routinely putting those onto the platform, and we let our partners know, our customers know, on a monthly basis as we put new programs on. So we tend not to do them one at a time, but we might say, here's another 10, here's another 10 programs that are on. And then just drawing to a close now, the benefits to the worldwide health and social care workforce, just to summarize, we have an exceptional portfolio of e-learning that's offered via a very robust and well-established platform. The content that we have is very widely well respected, and we have some really they are internationally renowned and revered content authors. So the provenance of the content is very, very good. Certification is available where appropriate. The learning is paced by the individual learner, and I think in today's busy environment in which we all operate, trying to squeeze in great chunks of e-learning can be a real challenge. So the ability to have 24/7 access to this content, and to be able to, as I say, just dip in and dip out and just self-pace yourself, I think is really valuable. And it's a very, very cost-effective model, because we don't want to make this exclusive. The whole benefit, or the whole raison d'etre, our reason for being, is to improve patient care via good accessibility to high quality e-learning material to the international health and social care workforce. So we don't want to make this content really expensive, which makes it inaccessible to lots of people. So it's very modest. The cost is very, very modest. And it's worth saying, as I've highlighted down the bottom here, that eIntegrity, as a community interest company, has the remit of any excess profits, so after our costs are removed, is directly invested back into the content providers, so the Royal Colleges and professional bodies, to enable them to update and increase the breadth, the coverage of the content that they have, as well as some funding going back into Health Education England to support with the platform, etc. The feedback that we get, as I say, is very, very positive. Universally very, very positive. And I would ask you all to explore the Medvarsity website, where you can see the content that is offered via Medvarsity, or even visiting the integrity website and maybe getting a bit more information there. So that was the end of my overview. Hopefully that was useful and perhaps even interesting to many of you. I can see